Okay, before I can insert the oropharyngeal airway, I'm going to perform a triple airway manoeuvre because I don't suspect any cervical spine injury. So I do a head tilt, chin lift and a jaw thrust, and I can see that the airway appears clear. So I'm going to take my OP airway and measure it up from the lips to the angle of the jaw. I can see that this is the correct size for the patient. So I'm going to insert it upside down until I reach soft palate, at which point I'll spin 180 degrees and insert until it sits flush with the lips. I won't take the lips over in case I cause further damage. I'm going to auscultate the chest. And I can see that there's equal airflow. Alright, before I can insert the nasopharyngeal airway, I'm going to inspect my patient's airway, tilting the head back because I'm not suspecting a basal skull fracture or cervical spine injury, and I can see that the airway is clear. I'm going to measure my NPA from the tip of the nose to the tragus of the ear, and that's the correct size for the patient. I'm going to take the lubricant and spread it evenly over the surface of the NP airway. To insert it, I'm going to place it up against the right nostril. If there was any deformity or trauma to the right nostril, I'll go to the left nostril. I'm going to place the bevel of the NPA against the septum of the nose and gently rotate as necessary to insert it. And push it all the way down, like so. Now I can observe the chest for equal rise and fall. I can see that there is equal rise and fall. And I'm going to auscultate the chest for airflow. And there's equal airflow. I can see that there's no blanching of the nostrils, so that's the correct size for the patient.
Hi Kyle, my name's Dee and this is Liz. We suspect you might have a C-spine injury, so we just want to stabilise your neck so cause any further unnecessary damage. If I ask you any questions or talk to you, could you please respond verbally without any movement of your head, please?
Okay.
Now Liz is just going to measure your neck by placing her fingers between your chin and your shoulder.
It's 3 fingers.
And now she's just going to adjust the collar.
It's short.
She's just going to place the collar underneath your neck. And we're just making sure it's not caught on your ears, or you don't have any jewellery there. It's nice and firm. And there's no collar in the way.
Hi Nikki, I'm Elizabeth and this is Emma. We suspect that you have a pelvic fracture. To stabilise it, we're going to use this SAM pelvic sling. Do you have anything in your pockets? No. Use our eye if we check. Yeah. Just going to slide this under your knees here. There we go. Just going to put our hands here and raise your pelvis. Yeah. Check that it's in the right spot in the pubic symphysis. Yep. I'm going to slide this in through here and pull on the black and orange until you hear a click. Are you comfortable with that then?
Yep, that's good.
Hi Liz, I'm Nikki and this is Dee, and we just suspect that you have a femur fracture which is up here in your leg. So we're just going to add this donway splint to your leg to add some traction to the fracture and immobilise your leg for transport. So my second officer here, she's just going to slide this one underneath your knee. Let us know if we cause any more pain, okay? She's just going to shuffle it up into the top of your leg while I put this onto your leg, okay? How's your pain out of 10 now?
About an 8.
About an 8, great.
I'm just going to do this strap up nice and loosely.
Great, so we're just going to put these ones up and lock them into place. Fantastic, and I'm just going to slide this underneath your ankle. Making sure it's nice and high on your ankle, and doing up these straps. And then I'm just going to put these around your foot, making sure your foot's nice and tight on this one, starting with the long strap. And make sure this is still nice and tight. There we go. I'm just going to check your capillary refill. That's great. And your pedal pulse. And your foot's feeling nice and warm, which is really good. Okay, so I'm just going to pump this one up until it's in the green section. You might feel a bit of pain, so just let us know if it gets too much. Alright, so that one's up into the green section. So we're just going to add these straps underneath your leg just to immobilise it even further. And we're just going to do those ones up nice and tightly with the buckles. How's your pain out of 10 now, Liz?
It's about 6.
Alright. We've got one more strap that just goes up here above your knee. It's just going to add some more traction. There we go. Not too tight. Dee here's just going to do up the strap nice and tightly at the top of your leg, and I'm just going to recheck your capillary refill, which still looks great. So I'm just going to recheck that this is still in the green section, which it is now. Fantastic. And Dee here's just going to lift up this so I can put down the stand. There we go. And we're just going to do up these collets here. Nice and tightly. There we go. How's your pain now? Are you feeling comfortable? Yeah. Great. So we're just going to make sure the straps are done up tightly, and I'm just going to let out the pressure. Great. My second officer here is going to go to the ambulance and grab the stretcher for transportation.
Okay, Liz, now we're just going to get a NIEJ extrication jacket on you, just so we can get you out of here. What we're going to do is check your pockets, there's nothing in them. Excellent, nothing there. Okay, we're just going to tilt the chair back, and we're going to insert the NIEJ jacket at a 45-degree angle across. Would you be able to hold the front of your head, please? Sure. Excellent. Great. Okay, now that's on. Excellent. Now we're just going to insert the lumbar spine pad, deflated, all the way down in. And once that's in, we're just going to put the chair back upright. Excellent. Great. Okay. Now, what we're going to do is grab the groin straps, and we're just going to pull them through underneath your groin, up into the gluteal fold, and we're just going to leave them there. Great. Okay, we're just going to check the jacket's nice and in line with the body. Yep. Okay, great. Now we're just going to, because we don't suspect any respiratory disorders with you, we're just going to use the shoulder straps and put them across your chest. Great, and we'll tighten them up. Okay, does that feel okay? Yeah, excellent. Okay, now we're going to put the torso straps across, yellow first and then red, and tighten them up. Just let me know if it feels uncomfortable at all. Okay, once we've done that, what we're going to do is then we're going to put the groin pads on, the groin straps, and we're going to tighten those up as well. Okay, just let me know if this is uncomfortable in any way. Okay, we're just going to tighten it up. Excellent. Can we just recheck the straps, guys, please? Just check they're nice and tight. Great. Yep. Okay, now what we're going to do is get the cushions, the head cushions, and put them behind your head. Yep. Excellent. Just position them right behind the head. Okay, now I'm just going to slowly move my hands away from your head. And now we're just going to attach the chin strap in line with the chin and tighten from the front. So tighten it from the front. Excellent. Good work. Yep, and then we're going to put a forehead strap on and tighten it from the front. So in line with the eyebrows. Don't cross the straps. Now we're just going to get the extrication board from the ambulance and take you off to hospital.